Chapter 16, Periodontal Disease. Definition and prevalence of periodontal disease. Periodontal disease is an infectious disease process that involves inflammation of the structures of the periodontal. Causes a breakdown of periodontum, resulting in loss of tissue attachment and destruction of alveolar bone. Prevalence of periodontal disease. Periodontal disease is the leading cause of tooth loss in adults. 47% of adults 30 and older have a form of periodontal disease, and 70% of adults 65 and older, almost all adults and many children, have calculus on their teeth. Structures of the periodontum include gingiva, epithelial attachment, sulcus, periodontal ligaments, cementum, and alveolar bone. Bacterial plaque, dental plaque, oral biofilm, and calculus provides a surface to which biofilm can attach. Two types, supragingival calculus, that's found above the margin of the gingival, and subgingival calculus is on the root surface below the gingival margin. The systematic connection. Chronic inflammatory periodontal disease may significantly affect health conditions such as coronary heart disease, stroke, or preterm birth. Chronic inflammation appears to do harm to the entire body. Certain systematic conditions increase the patient's susceptibility to periodontal disease. Periodontal disease may actively increase a patient's susceptibility to systematic conditions. Cardiovascular disease. Individuals with periodontal disease have a greater incidence of coronary heart disease, preterm or low birth weight. Women with severe periodontal disease have 7 times the risk of PLBW infants, and respiratory disease. Individuals with periodontal disease may be at increased risk for respiratory infection. Other risk factors: inflammation caused by an accumulation of bacteria in the biofilm. Disease-causing bacteria are necessary for periodontal disease to occur, but they are not totally responsible for the destruction of periodontum. Other risk factors alter the body's response to bacteria that are present in the mouth. Stages of periodontal disease. Periodontal disease is an inclusive term describing any disease of periodontum and includes the following: gingivitis and periodontitis. There are 4 stages: gingivitis, early periodontitis, moderate periodontitis, and advanced periodontitis. Gingivitis is inflammation of the gingival tissue. It's categorized by areas of redness and swelling. There's a tendency for gingiva to bleed easily, limited to epithelium and gingival connective tissue, no tissue recession or loss of connective tissue or bone. Most common gingival disease and easiest to treat. Improved daily hygiene can reverse. Periodontitis means inflammation of the supporting tissue of the teeth. Extension of inflammatory process from the gingiva into the connective tissue and alveolar bone that support the teeth. Progression of periodontitis involves the destruction of connective tissue attachment at the most apical portion of the periodontal pocket. In 2017, the American Academy of Periodontology developed a new classification system for periodontal disease, staging system, and a grading system. This will help clinicians develop a comprehensive treatment strategy based on the patient's specific needs. Stage 1 through 4, severity, complexity, extent, and distribution. Grade A is a slow rate of progression, B, moderate rate of progression, and C, a rapid rate of progression.